When a patient and a family, a patient comes onto hospice, it's really about getting into their home and meeting with them and their family or the people that are important to them in their lives. Sometimes that's a caregiver, friends, family, whoever's important to them. And we want to get in there and assess what's going on with the patient. We want to figure out important things like who do you have in your life that's a resource? Do you have funds? What are your goals at end of life? We talk about advanced directives, we talk about funeral planning, we talk about really important things so that we can make sure we know what the patient and the family is expecting at the end of life and that we can walk them through that journey. We also want to know about their code status. And this is a hard conversation to have with people. They don't like to think about it or talk about it, and sometimes they really do need some education around it. Do they want to be resuscitated when their heart stops? Do they want to be intubated? Do they want to go to the hospital anymore? One of our goals is to try to keep people out of the hospital, but that's not always their goal. And so we really want to discuss, is that something you want? When would that be appropriate for you? And so we want to discuss those things so we know what their goals are so that we can reach those for them.
One of the things social workers do is we can give very practical resources.
We reach out to these agencies that cover certain towns so that they can provide home health aid, personal care, grocery shopping, Meals on Wheels, so sometimes we can connect people that way.
And the social worker's role is to understand who the patient is and who were they before they were ill, who they were in their family, and helping loved ones with those conversations, helping them to share those memories, share those stories is such an important part of the grieving process. People don't think there's hope at the end of life, but it's actually a very hopeful time because in sharing those stories, they can help feel more connected.
And so a lot of times, if somebody has been taking care of their loved one for a long time, they feel very isolated because they haven't been able to connect with their friends, they haven't been able to get out or do anything. And so they're often alone, and to have a social worker come in and just listen to your worries and validate what you're going through can be really helpful. And sometimes we can find volunteers or support groups that they can go to so that they know they're not alone, so that maybe a volunteer can come sit with their parent or loved one for an hour or two so they can get out every week just to have a break.
I think the most important thing we do as social workers is really give ourselves and really be a compassionate presence when families are really struggling at the end of life. It's a difficult job, but I can't imagine a more rewarding job.